course, he has promised to ensure that the nation is fully up to date on measures that the government is taking concerning the global pandemic also affecting Jamaica, COVID-19. May we ask the Prime Minister to now address the few persons in the room and certainly everyone in Jamaica. Mr. Prime Minister?
Good evening, everyone. Good evening, Jamaica. Welcome to our regular post-cabinet press briefing, which we are doing it social distancing style, and we're doing it remotely or virtually. Let me start by again acknowledging the workers on the front line, our health workers, our doctors and nurses. We note that a health worker tested positive yesterday, and I hope she's doing well, Minister. She's recovering. The Cabinet reviewed the policies that are in place to address the COVID-19 epidemic, and we have decided on some additional measures which we find at this time to be necessary given where we are. The first measure that I would like to address is the movement of citizens. We have gotten reports from right across the island, and it is clear that whilst there was a fairly high level of compliance to the various orders that were made over the last 2 weeks, that over the last weekend, we recognize that there is an increase in movement. This increase in movement has come at a time when we are expecting that there would be a greater probability for infections, given the fact that we have had coming into the island close to 7,000 visitors and residents and Jamaicans and citizens, of which approximately 1,500 left the island. So we're still having a considerable number of persons who would have come into the island who we cannot say with certainty that they were faithful to the quarantine rules. And therefore, they are generally abroad in the society. They are within the country, moving around. The challenge with that is that that could be the precursor of community spread. And so the more you are moving around, the more likely it is that we could have an increase in the numbers. Indeed, having gone 20 days since our first case, and having seen that our increase relative to other countries of similar size has been relatively low, we are expecting that there will be a rise, in fact a significant rise, in the number of infections that have been confirmed. Having regard to that, the Cabinet carefully considered weighing the economic impact of these measures, but we decided, as we have always done, that the public health is of greater importance. And therefore, I'm announcing today that effective 8 p.m. to 6 a.m. for 7 days, starting on April the 1st, there will be an all-island curfew. Let me repeat. The police has been instructed to enforce an all-island curfew starting at 8 p.m. to 6 a.m. the following day. And this starts on the 1st of April to the 7th of April. In fact, AG, it would roll into the 8th of April at 6 a.m. Just to be clear on that. So the curfew would start on April 1, 8 p.m., and it rolls for 7 days, and therefore it would end on April 8 at 6 a.m. Everybody has got that clearly? Just for clarity. So you have 24 hours notice effectively. So the curfew, all island curfew, that will start on the 1st at 8 p.m. It will end on the 8th of April at 6 a.m. Good. That means that there will be restriction on public transportation and all movement except those that will follow in the Gazette. And we will have the Gazette published tomorrow. Of course, we will have to make the regular exemptions that are usually made when curfews are called for medical staff, security forces, essential services, and special provisions will be made for other critical industries, but that will be announced very early tomorrow when the Gazette is published. We ask everyone to make the necessary arrangements in their daily affairs to ensure that they can be off the road. We'll say some more on this when we return. I'm going to ask Minister Tufton to come and give an update as to the numbers and the new proposals for testing.
Thank you very much, Honorable Prime Minister. Members in the room, colleagues, members who are virtually connected. So the team has been working very hard, and I want to just use the opportunity to commend them, the health staff, led by, of course, the Permanent Secretary and the Chief Medical Officer, and, of course, supported by the Cabinet and the Prime Minister, who is leading the charge. To date, as previously announced, we announced this last evening, we currently have 36 confirmed cases of COVID-19. That's 4 additional cases from previously announced, so 4 additional cases in the last 24 hours. The members are a 54-year-old female from St. Mary, and the mode of transmission is under investigation. A 34-year-old female from St. James with a travel history to New York. A 74-year-old female from St. Catherine with a travel history from New York. And our first frontline healthcare worker, a 45-year-old female with a contact with someone who was being treated, one of the positive cases. And I want to just pause to recognize the risk that our frontline healthcare staff take every day, not just in this case, but certainly this is a heightened risk given the nature of this particular condition. I want to recognize them. I want to ask the country to join in giving them the fullest of support. If you look at the history of taking on these infectious diseases globally, the individuals who are most at risk and normally are first to be infected or impacted are normally the frontline healthcare staff. And we're witnessing this today. A very diligent individual who works hard and who was in the line of duty exposed. I'm happy to report, however, as the Prime Minister said earlier, that she's doing well. We believe that her prognosis is very positive and that she will recover. She is currently in isolation and being given the best possible treatment. The ministry, just to be totally clear, has no other record of any other healthcare worker who is impacted. by COVID-19. And I want to make that very clear for the record. There are now 23 imported cases of the total number, 11 import-related, 2 cases are under investigation, and the average age of the persons who have been infected is 52.7 years, ranging from a minimum of 24 years to the eldest at 87 years. The ministry is pleased to advise, too, that one of the patients, patient 5 from St. Anne, who tested positive for COVID-19, has now recovered and has been released from hospital. So I think we can celebrate our first fully recovered COVID-19 case. This is patient number 5. And there's a protocol to determining when one is released. And I want to just outline that and then make one other point. That individual, having been treated and become asymptomatic, meaning not displaying any other symptoms, would be tested twice within a 48-hour period. And if the tests return negative, then the conclusion is the person is fit and ready to be released. And this has been the case with this individual. This individual was released last evening, I'm told at about 10 p.m. I want to also say on this point that it is very important that the population accepts that COVID-19 is a risk, is a disease, but a disease that can be treated, and those persons who are unfortunate enough to have been affected, once they return to their community with the certification by the medical team that they are now well, they should be incorporated, reintegrated, and not treated in any way, shape, or form in a discriminatory manner. And I think that's very, very important. 51 persons remain in isolation, 34 persons are under quarantine in government facilities, and in addition to that, we still have 140 Cuban health professionals who came into the island a week or so ago, who are in quarantine now and will be deployed once they go through the quarantine period. We have now tested 362 samples, including the samples that were tested for severe acute respiratory infection. 36 would have tested positive, 317 tested negative, and 9 tests are pending. And in terms of the testing, the CMO, I'm sure, will elaborate a little more on it, but there have been some concerns as to whether or not we are under-testing. I just want to say that the team has had discussions with a wide cross-section of specialists up to last evening. We constantly review the testing methods, and we have a sort of stages of testing that targets different elements of the population: frontline health workers, persons who are not related to a positive case but have upper respiratory ailment, as well as persons that we have traced linked to a positive case. And so we are satisfied that we have a good sense as to the extent of the virus in the population. Nevertheless, there are some new methods of testing which will see us increasing the capacity to test. The extraction process of testing at the National Influenza Center is being automated for greater efficiency, and this will increase the numbers for testing up to 100 tests per day. The National Public Health Lab is installing a Cobas 6800 machine. The next 3 weeks, equipment installation and training of staff will be completed, and the facility will be able to expand testing capacity to up to 380 samples per 8-hour day. Right now, we're using less than 20% of our testing capacity, so we still have significant capacity. And you will see additional efforts being made, including using mobile units to go out into the parishes to collect samples for testing. And we'll elaborate more on that in short order. I'll just wind down. The community quarantining continues in Corn Peace, southern Clarendon. Of course, the Bull Bay residents have now been allowed to leave the community. We still have particular householders under supervision, and we are still in touch with the community. And I want to just use the opportunity to say thanks to the members of the Bull Bay community for collaborating with us. I'll stop here now and just hand back to the Prime Minister.
Thank you very much, Minister Tufton. So it is very good to hear that we have released one person who has fully recovered, having passed your two-stage testing protocol for verification of recovery. And that is a good sign. And there will be more, I'm certain, in the coming days. I want to go back to the point that whilst we have over 361 tests conducted and only 36 cases confirmed as positive, there might be a sense of complacency setting in. It might be that the population is believing that this will be how it will be for the next 2 or 3 weeks. The point of fact is that projections have been done, and I'm going to invite our CMO to join me and ask that the graphs that show our projections be placed on screen. CMO. So the Ministry of Health has done some projections looking on whether or not our numbers will double in the next 10 days, 8 days, 5 days, 3 days, and the next 2 days, and what that could look like. CMO?
Okay, I just want to reiterate what the Prime Minister has said in terms of complacency. I want to really caution the population that this is the time when we have to be extra vigilant. We have been doing pretty well so far, but I want the population to realize that we now have 36 confirmed cases of COVID-19 in the population. That means that at this time, we have the potential to have more cases. We have a lot of persons who have come into the country who may not be self-isolating or self-quarantining themselves. And these persons are at risk. They put numbers to shoot up. So the population has to understand that while it appears to you that things may be looking good, if it is that you do not take action now, then things have the potential to get very worse. Right now, we are keep the curve flat, and flat meaning below what it is that our health system is able to manage, where they may have been exposed. If they do not stay at home, they have the potential to infect other persons, and our numbers are going to go up. If there are persons who have had contact with our 36 confirmed cases, if they do not stay at home, then our numbers will also rise. And we will move from a potential doubling every 8 days to possibly a doubling every 5 days, and worst case, where we could have a doubling every 2 days, resulting in a significant number of cases. According to the graph here, 4,608 possibly confirmed by the 12th of April if it is that persons do not take their responsibilities seriously and stay home. So this is, we may look good now, but this is the time that every single Jamaican has to be urgently looking around, ensuring that they stay home, ensuring that their family members stay home, ensure that their neighbors stay home. Everybody needs to start becoming a Ministry of Health and Wellness officer and do their part to keep us on this 8-day doubling trajectory, and even to lower that, even to lower us more than a doubling every 8 days. But we certainly would not want to be increasing our numbers. Now is the time that all that extra caution has to be put in place.
So if we go back, CMO, to that slide, which is very telling, so that people understand the numbers that we're looking at. If on the current trajectory, by your projections, you're saying that by April 5th, if there is an increase in infections such that you are doubling your number of infections, in 10 days you will have 61 cases by the 5th of April. If the infection rate increases above that, to where you're doubling every 8 days, then you could be looking at 68 by the 5th of April. If your infection rate increases to where you're doubling every 5 days, then you could be looking at 101 cases. That's right. If your infection rate increases above that to where you're doubling every 3 days, then you're looking at 192 cases by the 5th of April. And if you're doubling every 2 days, then you would be looking at 432 cases by the 5th of April. Now, the 5th of April is just next week. So if we have cases within the population, if we have persons who are carrying the virus within the population, we don't know of them, they are not self-isolating, they are circulating among you, then it is likely that the rate of spread will increase and your numbers will increase. The only way to stop that at this point is to limit movement. There's another way to stop it. If every well-thinking Jamaican, everyone who loves this country, who came back here because they said they love their country and they want to be with their family, and they genuinely stayed in and respected and be faithful to the quarantine rules, then that would also prevent us now from having to go to these measures which affect our economy and your ability to earn. Which leads us into having to make another decision. We will amend the order to require now, to mandate that those persons who came into the island and who are still here between the 18th of March and the 23rd of March, that they must report to the Ministry of Health utilizing the website which we published the last time, which is jamcovid19.moh.gov.jm, or call the Ministry of Health's hotline, which is 888 One Love. One Love. See, I know the number so well. So we ask that you utilize those two routes to contacting the Ministry of Health, and we ask that you faithfully disclose to the representative who answers the phone or the website that you're interacting with all the information that is required, particularly of your current health status and whether or not you were maintaining the quarantine, and how we can get in touch with you in terms of your address, telephone number, so we can understand your health status and assist you if it is that you are showing symptoms. I cannot overemphasize the importance of this to our national security, the safety of everyone, the health of the population. This is a turning point, this is how we view it, in this state of the epidemic. Just for a little bit more graphic illustration, I'll again invite our Chief Medical Officer to explain how the disease is spread, utilizing the graphs that you had prepared.
Right. So, all right. Essentially, this, based on what we have seen happening across the world, this disease, if you are infected, you have the potential to infect 2.5 persons. 2 persons infecting 5 persons. Now, if it is that we continue at this rate, we have looked at the projection to say that if 1 person affects 2.5 persons and 2.5 persons each infect 2.5 more persons, over a 30-day period, what it is that we will see happening is that we would have 406 persons infected. Now, that is a significant number of persons. If it is that we reduce the exposure by social distancing, and we reduce that social exposure by 75%, we have looked at the projections, and we see that by day 30, we would only have 2.5 persons infected. If it is that we reduce social exposure by 50%, then we would only have about 15 persons that are infected by that 1 person over a 30-day period. Now, can we look back at the graph? Now, the infection of 1 person, the transmission of 1 person causing 406 persons to be affected. I want everybody to really look at this graph and to understand the difference that we can make by social distancing, by reducing your exposure to other persons. You have to stay home. That is the first thing. Stay home, and wherever else you may be, you maintain social distancing. This is a significant amount of persons, a significant amount of infections that can result by 1 person being careless. 1 person attending any kind of social gathering where they pass on that infection to other persons, and then those persons continuing to be in social circumstances where they are passing it on. This is a very serious diagram that I'm hoping that everybody will look at carefully and understand what the difference that you can make just by staying home.
So thank you, CMO. We don't want to scare anyone. We don't want to create panic, but we need every single individual to act responsibly based upon credible information that is shared with them. As a result of these considerations and our own monitoring, we have been monitoring our markets. We have been monitoring the various entities that have been exempted under the various orders for public gathering. And we notice that there is not a faithful application of the social distancing rules or the gathering rules, especially at the markets. Thank you to those of you who sent me pictures of Coronation Market and all the other markets around Jamaica on the weekend. We can understand it was a month-end weekend. People are shopping, people are around, but we cannot ignore what we have just shown on the graph, which is that markets and other such areas are centers for spread. So we have taken a second look at the order for markets, and we have decided that we will make an adjustment to the order, and that is from Thursday, Friday, and Saturday, we will increase the opening hours. The order now stipulates that markets are open from 6 a.m. in the morning to 2 p.m. in the afternoon for the week. Now we're stipulating that from Thursday, Friday, and Saturday, the markets will open at 6 a.m. as specified, but they will close at 6 p.m. And that is to allow persons to use the market without clustering in the market, to allow persons to have more hours for scheduled visits to the market than to have everyone trying to get to the market before closing at 6 and therefore having congestion in the market and reduced space for social distancing. We have also observed that persons are still keeping parties and social gatherings. We are observing that there are persons still insisting on keeping funerals and grave digging and all kinds of activities, as if there is no threat. There is a threat, and therefore we called the commissioner to visit with the cabinet today to discuss an increase in the enforcement of the orders. With the curfew will come general enforcement, but all the other orders during the period of time allowed for work and travel, the police will increase their vigilance and prosecution of persons who violate the order. Also, you will notice over the weekend that the police stepped up their efforts to interdict persons who are purveying fake news, deliberately creating and distributing fake news. I have heard one in which the Honorable Attorney General's name was called, and then can you imagine, there was one with my name being used, and we are hotly pursuing both. In fact, we are pursuing all of them that are designed to create public mischief, and there was one arrest and charge for someone in Westmoreland who created that message and circulated. And there are others who have been called in by the police who have sought to recirculate messages that are designed to create panic and can only be classified as public mischief. I want to just bring everyone up to date again graphically. So if we could just run through the graphs, starting at graph number 1, which shows us where we are with the confirmed cases of COVID-19 in Jamaica. And as Minister Tufton said, we are now at 36 cases. And I think we are progressing fairly well relative to other countries. If we could move on to the testing. And I want to spend a little bit of time on the testing graph so that Jamaicans see exactly where we are. We have outlined, this is the next graph, we have done 361 tests and 36 are positive. The Ministry of Health would say that's a yield of a positive yield of about 10%. Well, as it is there now, 361 and 3, so it's about 10%. There are questions as to whether or not we are testing enough. I'm certain that the Minister of Health and the CMO has answered that we have capacity to test more. We will be testing more. The Minister of Health informed me that he will be increasing the testing capacity by having buses going out into the country, into the rural areas, into all the parishes, and testing in urban centers, in rural townships, in areas where people are gathered, so that you can have a wider test sample to see exactly what that picture is. But I'm fairly confident in the methodology applied and in the numbers that we have. As you can see from the graph, the blue bars are the numbers of tests conducted on a daily basis, starting from the 9th of March or before that. So you would see that we have tested as many as 50 cases in a day, and the red in the bars would show you the numbers that are confirmed, and the blue in the bars would be the tests that are negative. The totality of the bar would tell you the number of tests conducted. So I want to assure Jamaicans that we are testing. Yes, we can test more. We have the capacity to test more. The Ministry of Health has given us the undertaking that they will expand their tests, and therefore it is quite possible that you will see an increase in numbers. But certainly I'm not expecting that you will see a massive increase in numbers, because the methodology that was used, I think, was solid. Our fear is, however, that the unknown cases that have come into the island, if they are not quarantining, that they could cause a massive outbreak. I want to move on to this third graph, which is just for information, showing the number of tests versus the percentage yield of positive. See the numbers of tests per day, that is rising, and our positive tests are leveling off, which is a basic indication that our contact tracing effort is working. But again, the threat to that would be those cases that we have not contacted, we have no knowledge of, and we have no knowledge of the persons who they have infected. So that is right now the big threat to how we are performing as a country in this epidemic. To the next slide, please. Just so that we have an understanding of where we are in the region, we have a selected group of countries that would be similar size, similar circumstances, Caribbean countries. And you can see that these lines are showing all of them except Jamaica. They are all rising. They are at different stages in the epidemic. Barbados, for example, is in day 13 since their first case, and they now have 33 cases. Jamaica is in day 20 since our first outbreak, and we have 36 cases. The graphs look different because this would be the number of cases per 100,000. Jamaica's population is several times the size of Barbados, and therefore case per 100,000 we would be lower than that of Barbados. But then when you look at Panama, for example, Panama and Jamaica, almost similar size in population. Panama, it may be 2 to 2.5 million persons more than Jamaica, if that many. But their case, they have 989 cases, and they are 21 days since their first. Jamaica has 336, and we are 20 days. So clearly there is 36. Can I take that back from the universe? I take that back. 36. Jamaica has 36 cases. But clearly, from comparing both countries, that is what an outbreak could look like if we do not maintain control over the cases that are known and get knowledge of the cases that are not known, which is what we are now trying to do. So all the countries in the Caribbean, their infection curves are rising, and some of them rising exponentially. Ours relatively flat, but I hasten to say that could change in a day. It could change in a minute if persons behave in an irresponsible manner if we are not able to have persons who came into the island between the 18th and the 23rd self-quarantine and identify themselves to the Ministry of Health, given using the numbers that we have given, the 888 One Love, and the website that we have given, which is jamcovid19.moh.gov.jm. Ladies and gentlemen, thank you for your time and attention. We are now open to questions.
Thank you so much, Mr. Prime Minister. We're still live on national radio and, of course, streaming live on the internet. I understand both television stations have broken away. They got the first part of your announcement. Let's go to our Zoom feed with the reporters in the Zoom room. We have JNN, beg your pardon. Could you introduce yourself as you would if you are here? JNN, or first question?
My name is Michael Sharp, and I have not broken away. And I'm a television station, JNN that is. The question that I have for the Prime Minister is that the last time we spoke, you spoke of the manifest from the airlines that brought these people in, that you are very strongly appealing to make themselves known. It is clear to me that you have not been very successful. The question is, how many have you contacted and how many have you not contacted? Why you now have to change your order?
Well, I'll be the first to admit that the numbers that we would have liked to see make contact, we have not seen those numbers. We have in the hundreds that have made contact. I believe the last figure I heard was something like about 400 have made contact. And I want to thank those who have made contact and who have faithfully kept the quarantine. For those who are taking this thing, as we say in Jamaica, make joke. It won't be a joke when the measures are put in place to address it, being, first of all, the amendment to the order to make it mandatory to report, and that would be, of course, at the cost of a penalty, which are significant in the Act. You could be fined up to $1 million for breaching any of the orders under the Disaster Management Act. The other measure that we have put in place is we are now scrubbing the list. In other words, the manifest list, which is the list provided by the airlines of persons who would have come into the country. We are matching that against persons who would have left the country who came in during that period of time. So we have a net list of persons who would be targeted. Then we will have to reduce that list by those persons who have made contact so that they are not on the list for prosecution. And then we will have to find addresses, which is to match addresses to names, which is another list that is there, which we would have gotten from the immigration, and that is now being done. The Ministry of Tourism and the Ministry of National Security, they are working behind the scenes to match that list. So we will have a list, and Customs helping. Once we have that list and there is a high level of confidence and certainty in the accuracy of the list, then we are faced with a decision, and that decision would be to publish the list. And we have been very reluctant in publishing the list. We have been very cautious because we don't want to stigmatize people. We don't want to, in any way trespass on the privacy of people. But we must also recognize that this is a public health crisis, and the law does empower us to take certain actions, but we can't, of course, abuse it. So we're taking every measure that would be considered reasonable in a free and democratic society.
Thank you, Mr. Prime Minister. Up next is the Gleaner Company. I believe, yes, there we go.
Thank you. Prime Minister, I heard you mention that we are at day 20 of the COVID in Jamaica, but the Health Minister's graph has shown that the first patient, that's patient, I beg your pardon, the Health Minister's graph has shown that patient 6 reported an onset on March 1, and patient 5 reported an onset on March 3. I'm interested to know, where were patients 6 and 5 when they reported this onset?
Just to be clear, that we measure the start time of the outbreak from the confirmation So that's the point
Very
that
well.
we use. CMO?
Very well, but I'm really eager to know though, where were patients 5 and 6? Patient 5, the ministry has reported, was showing an onset of the symptoms on March 3. Patient 6 was showing an onset of the symptoms on March 1. Where were
the
they? Who
CMO
did
is
they see?
checking her records to give you an answer.
Good.
Patient 5, you're looking at patient 5 and you're saying that they had a date of onset on
Patient 5, March 3, patient 6, March 1.
Okay. Right, so the date, we are actually measuring the time into the epidemic for us is the date of the confirmation of the first case. Okay? So I just want to make that clear. So the day 20 that Prime Minister would be speaking about would be counting the first from the 10th. Okay, in terms of where was patient 5 and 6 when they started to have symptoms, is that the question? So patient,
Yes, I'm interested to know that.
patient 5, as far as we know, was in country. Patient 6, who's patient 6 again? Sorry, I'm trying to find patient 6 on my list to see exactly who patient 6 was.
Well, what we could do, if you could check and then so that we use radio time more
Right.
efficiently. So
But I just want to say
Except
that
Prime
though
Minister, that
I
I've been
can
waiting
answer.
for almost 7 days now for an answer to these
I can
questions, which I
answer for
think
patient
are very
5
important.
to say that patient 5 was symptomatic in country from our investigation, started symptoms, and I just want to let you know that we have done the contact tracing for patient 5 in all their household contacts, and their household contacts have been negative. There was one of the possible the cases that we had under investigation where we were trying to determine if that patient was a possible link to patient 5. We have come to the conclusion that yes, that person is a possible link to patient 5. So we have one contact of patient 5 that was positive. I will have to check to give you the information on patient 6.
Thank you.
Thank you, CMO. Let's move to NNN. Can we have NNN up? Okay, there we go.
Okay, hello, good evening. All right, so given that the government is relying on moral suasion when urging persons to self-quarantine, how else does the government plan to empower persons to make this process of self-quarantine more effective? As well as, could you just outline the details of the curfew as well as the parameters?
Well, just to be clear, the government is not relying wholly and solely on moral suasion. My own view is that once Jamaicans are empowered with information and they are seized of the importance, then there is no stronger force than a Jamaican so empowered and so motivated. So the strategy of the government is to enlist the support of the goodwill of Jamaicans in fighting this epidemic. So we do spend quite a bit of resources and time in communicating with the public, in providing them with information, and appealing to their good conscience. Nevertheless, we have also utilized the law as much as it allows us to in these emergency circumstances, and we have made various orders for which the police is empowered and provisioned to enforce and to prosecute. And they have been doing so, and we will be stepping up our enforcement in order to get compliance. So we are doing a twofold strategy. One is to get voluntary compliance, and two if we have to, and it seemed as if we will have to, is to get compliance by enforcement. I think that the CMO and the Minister of Health and the Permanent Secretary would say generally that those subjects of quarantine that we have knowledge of and that we have supervised, that by and large they have maintained the quarantine. Would you say that, CMO? That those subjects over which you have knowledge and supervision for quarantine, that they have by and large maintained the quarantine. And which is why the figures are what they are. It is for those subjects who we have no knowledge of and who we require them to self-quarantine and report that gives us cause for concern. It may very well be that, 70%, and this is just an arbitrary figure, self-quarantine and are faithful to the quarantine rules. But the 30% who don't, as you see the infection rate for one person, and that is the danger.
406.
Mr. Prime Minister, thank you. Let me quickly go over to Sun City Radio in Portmore. Kevin Jackson on Twitter is asking, Prime Minister, are you aware of the fact that persons are still flocking beaches, particularly Helsha? What would be done about that? And two, he's asking for a comment on the entertainment sector that is reeling from some of the measures.
The police has general powers of enforcement of the orders for any activity that is in violation. I think that in the coming days, you will see the police making greater effort at enforcement, including gatherings at beaches and parks and other such places. In terms of the entertainment community, it wouldn't just be the entertainment community, but I'm feeling it for all the bartenders and the bar operators and the people who sell on the street side and all the people whose income doesn't allow them to have a savings or a store of savings from which they could live in a period of shutdown. But the truth is, again, it is either we go with the economy and have our health collapse, or we try to find a way to balance it where we allow some economic activity in a controlled way and protect our health at the same time. It is by virtue of a long and studied approach to these measures that we have come down on deciding that we cannot have gathering spots such as bars and entertainment events the same way we have had to treat with funerals and weddings, the same way we have had to appeal to the churches, that these things have to be controlled. But I've seen, even in the depths of this despairing epidemic, the tremendous creativity and innovativeness of our Jamaican citizens. I was invited to follow and observe an online party put on by one of our popular DJs and entertainers. I spent a few minutes in the virtual dance hall and then disappeared. But it seems to be catching on. People are finding ways of coping in this time. The truth is that the more we comply, the shorter is the period of constraint.
Thank you, Mr. Prime Minister. Let's go to Edmund Campbell.
Thank you very much. Prime Minister, could you, or the minister, the CMO for that matter, could you indicate for us the healthcare worker that was tested positive?
CMO.
Could you tell us, first of all, what's the nature of that person's job, one, and two, when was the test done on this person?
Thank you, Edmund. The CMO is approaching.
The CMO is coming to address that.
The person is in fact a registered nurse at one of our hospitals. In terms of when the test was done, I can tell you that we received the result yesterday. I can't tell you exactly when the test was done. I really don't have that info. Usually we have a 24-hour reporting, so it probably would be within the last maybe 48 hours.
All right, thank you, CMO. Let's move to Owen from Roots. Owen Good evening.
Yes, good evening. Thank you so much. Yes, I have about 2 or 3 questions. Um, with regards to the curfew, we've seen we're from 8 to 6. I want to ask basically, as opposed to 7 days or 14 days, what, you know, that decision instead of 17 days, why say 7 days? Another question I also have with regards to regulation of taxi operators and bus operators. Some of the, not just the minibus, but the ones that run like probably from Spanish Town to Portmore. Those buses, they have um, cramped space. Is it that there is any regulation for those kind of transportation? And also, I wanted to ask regarding the contact tracing for persons in corn peas. How far is that?
Thank you, Owen.
A very, very good question. So let me just repeat that the curfew starts on the 1st at 8 p.m. I should probably share some of the considerations that we looked at how that would impact business and livelihoods. Original suggestion was to start at 7, but we did a careful analysis, especially looking at persons who work on shift and who would be working overnight on shift to give them time to get to work and continue at work as long as they're not moving outside of work. And so we settled on having the curfew start at 8 p.m. on the 1st, and it will continue to 6 a.m. the following day, and then start back at 8 p.m. on that following day, and continue until the end, which would be on the 8th of April at 6 a.m. Why not go for 14 days? All of these measures are reviewed regularly because we have to gauge the impact on the economy. We have to gauge how successfully they are being implemented. And so we are being very cautious with how we put these measures in place. Everything has a limit, even our enforcement capacity, and we have to recognize that we have to operate clearly within the limit and capacity of our resources. So we're going to do it for 7 days. We'll watch the numbers. We'll see whether or not it has an impact on the numbers, and then we make adjustment. In the same way as we have studied very carefully operations in the markets and other such areas, and we have made adjustments to the order, just to make sure that as much as possible we can survive both from a health perspective and our economy and livelihood perspective. In terms of taxes, the curfew is a strict curfew, so it means there should be no movement at all after 8 p.m. except for those essential services and other services and personnel that are named in the order. So we are considering making an exemption for persons who work in the business process outsourcing industry once they can produce their ID, and that can be shown. The ground commanders will have their orders as to how they should treat with that. We cannot afford a collapse of that industry. It employs 38,000 workers, and indeed, in many instances, they provide essential services in terms of call center operations, telecoms, and the like. So they have to be up. Obviously, nurses and doctors and the Minister of Health is asking for an exemption. Madam Attorney General, you will have to make an exemption for himself and the CMO and the Permanent Secretary.
Thank you, Mr. Prime Minister. I see the time being 7:43. We'll take 2 more questions from Zoom. We'll go to Alicia from The Observer. Alicia? I think she's trying to turn her mic on. We're not hearing you very well, Alicia. You'd have to turn the mic on. All right, let's go to Dashan Hendricks and then come back to Alicia. Dashan from TVJ.
Good night, Mr. Prime Minister and CMO. I'm just asking, what about the other patients? What is their conditions? Are they recovering? Any on ventilator? How many ventilators do we have, and how many more do we need given the projections?
As the Minister of Health had mentioned earlier, we have had one person now who has completed 2 negative tests and has been released from hospital. So in addition to that, we have maybe about 3 or 4 persons that have been are completely asymptomatic, and so they have started their testing process. The majority of the persons remain fairly stable with just mild symptoms such as a persistent cough, some dryness in the throat. We do have 3 persons that we consider to be serious enough that we are monitoring very closely. We have 1 person that was on ventilator. I have not gotten the update for today, so I'm not sure if the person has been weaned from ventilator today, but we have that 1 very critically ill person that we're monitoring very closely.
Thank you, CMO. Let's see if we can get Alicia back. Just to wrap up, then we give the observer a chance. Alicia, let's try again. I believe she may have some technology issues on her part. Alicia?
Right, I don't know what's been happening, but I'm sorry about that. Can you hear me now?
Perfectly. Go ahead with your question, please.
Right, all right. So on Friday, the Permanent Secretary for the Ministry of Health had indicated that there was an HR system that was being worked out that should have been launched today for persons who have either been self-quarantined or who have been quarantined by the state. I just wanted to know whether that procedure or process had been completed.
So thank you for that question, and thank you, Prime Minister. The HR system is complete. However, we had to load it with the TRN database, which required us to ask for an additional day, and so it will be launched tomorrow to ensure that the TRN database could provide the verification information for persons who would interact with the database. So tomorrow we will be launching that database from the ministry, and we'll be publishing the how-to guidelines for persons to interact with the database.
Thank you so much, Mr. P.S. Mr. Prime Minister, thank you for fielding questions and, of course, your updates. As you close, sir, just a few points I'm seeing on social media. Persons generally in the public want a full clarification on the measure you announced concerning the curfew and what constitutes essential services.
Well, let's go back to the curfew. It's a general order of no movement, obviously, outside of your home. So no movement in public spaces, no driving on the road between the hours specified in the curfew, and the hours specified would be 8 p.m. to 6 a.m. on the days over which the curfew order will apply. The curfew order will take effect on the 1st of April, and believe me, we are not fooling with it at all. Well, April 1, but this is serious business. So I think most Jamaicans understand what a curfew means, and the policemen and other law enforcement officers who will be on the road will have the powers of arrest, and they will use their discretion to send you back home, to escort you back home, if you resist, obviously. I mean, I don't know how the police will utilize the powers that they will have. Obviously, they will. The Minister of National Security is here. We expect that it will be used in a way that is respectful of the dignity of the citizen, and we expect the citizen to obey and comply with the lawful orders that they receive from the police force. Right? All the other orders that we have put in place, which are gazetted, remain in place. So the police would now have the ability to intervene if they, for example, saw 15 persons gathered, they can disperse the crowd. If, persons are not maintaining social distancing in an establishment that is allowed for opening and gathering and serving the public. These are matters that the police can address by virtue of the orders given. We have now made an order to ask all persons who have come into the island between the 18th and the 23rd of March that they must report using the website, which is jamcovid19.moh.gov.jm, or call 888-1-LOVE and fill out or give the information required. And the order as well makes it mandatory that they quarantine themselves for 14 days starting from the date of their arrival. Ladies and gentlemen, thank you for your time, and the government of Jamaica will continue to provide you with useful information to empower you to be a responsible citizen and a good agent in the fight against the COVID epidemic.
Thank you so much, Mr. Prime Minister, and all the officials who are gathered here this evening. Ladies and gentlemen, and the viewing audience, we thank you so much for watching, and certainly the Prime Minister has committed to continuing to ensure that you remain up to date on all the decisions made by Cabinet and certainly the measures implemented by the government of Jamaica to deal with COVID-19. Good evening, everybody.